The nail salon industry is a booming small business industry that does present a lot of hazards for the workers within this field. This largely female dominated industry, we are trying to provide these women with the knowledge, empower them, and better teach them how to protect themselves. Hi, I'm Dr. Aurora Lay, an associate professor at the Texas A&M University School of Public Health. So, for nail salon workers, I like to say that they are often emblematic of immigrant, low wage women who work in the service industry, who are in our communities, but they're often invisible and overlooked. So, like any other industry, a lot of times the care is paid attention to the consumer. We want to protect consumer health. We want to make sure the customers are safe, which is very valid. But that also means that sometimes the health of the workers is neglected or falls to the wayside. And so, in the nail salon industry in particular, you encounter the entire spectrum of occupational hazards you can encounter. And most of these women happen to be of childbearing age. And so in the nail salon industry, there is a host of chemicals, some that we know are cancer causing agents like formaldehyde that are nail polishes and thinners, methyl methacrylate, toluene, acetone, ammonia. And so they are inhaling these consistently on a regular basis. Most nail salon workers also regularly work overtime, so it's not a 7 to 8 hour shift. Most of these women are working anywhere between 9 to 11-hour days, 6 to 7 days a week. And many of them that we have talked to also, because of their financial situations, continue to work well into the third trimesters of their pregnancies. So in addition to inhalation hazards, respiratory irritation, contact dermatitis from the chemicals, studies have shown that there's obviously impacts on the fetus when these nail salon workers are still working through late in their pregnancy, where they may have placentia previa or low birth weights in their children. And it's been known to have caused cancer in the long term for some nail salon workers. There's also biological hazards that they regularly encounter. So customers coming in knowingly or unknowingly with foot fungi, accidental cuts and abrasions that expose them to bloodborne pathogens, respiratory hazards like the common cold and flu, but also during the COVID-19 pandemic as well. There's physical hazards such as poor ergonomics. They are bending constantly or holding awkward postures when performing manicures and pedicure services, repetitive motions when filing or drilling and painting that can cause musculoskeletal disorders like neck pain, lower back pain, carpal tunnel syndrome, tendinitis. And now we also have to worry about the potential of radiation exposure as well, which can lead to cancer. Now that there's a lot of these UV curing lights in salons for gel and shellac manicures. The question is, how do we help better prepare women or individuals who work in nail salons or maybe in the manicuring industry? So traditionally, you can get licensed as a manicurist one of two ways. You go to cosmetology school where you pay a nice tuition to go learn through that process, or the more common route, which is apprenticeship, where you shadow somebody who's already licensed and then go on to take your certification exam. Now, even in cosmetology school, they spend very little of their curriculum actually talking about occupational safety and health. For a semester-long curriculum, that's maybe an hour or two maximum. And if you're doing an apprenticeship, the occupational safety and health hazards may be only covered anecdotally or if it ever comes up, if ever. Also, when manicurists go to renew their license, there's no continuing education requirements. So if workers really want to learn how to protect themselves, they really need to be doing this on their own time or on their own motivation. And given what I've told you about how most of them work overtime and they have to go home and meet the demands of their families and communities, generally learning how to protect themselves falls by the wayside. We created this free self-paced online learning module geared towards adult learning that takes only about an hour and results in a certificate of completion that they can display next to their license or at their manicure station that essentially refreshes them on the common chemicals that they'll encounter in providing nail services. And we offer this free training module both in English and Vietnamese, as nail salon workers in this country are predominantly Vietnamese. In California, it's as much as 80%, and in other states, it's as much as 50%. So we want to provide these individuals with a culturally competent and linguistically appropriate training on how they can refresh themselves about what are they using every day, even though they may see it and they know it's in there, but they may not know the formal name for it or the short-term and long-term health risks. Okay, now you as a customer, hopefully everything I told you about the occupational risks for a manicurist doesn't stop you from getting these services. You should absolutely still go get your nails done because these are these people's livelihoods. And often we think about the nail salon industry as an intimate labor industry, not only because they are literally holding your hands or your feet, right? They are holding your hand, but you may come to a point where you develop a relationship with your manicurist or whoever provides services to you. You're going to them, chopping it up, talking about your life, catching up with them. So they are, to a certain extent, your friend. And that's why we consider it a labor intimate industry. But also, should want to care enough about these individuals to want to protect them. And in order for us to do that, the most powerful way we have is as a consumer. And so if you frequent a nail salon, please empower yourself to talk to the owner or to your manicurist about, hey, I would love and be willing to pay extra for services. If we were to reconsider some of the product selections here that don't have as harsh of chemicals in it, or if you're going into a salon for the first time and you notice, oh, the door opens and it smells super strong, just a cloud of chemicals hitting your face. And you notice perhaps in between services, we're not sanitizing between customers, or communal products such as bath salts or foot salts that we're using aren't segregated into separate containers. This might be something for you to mentally note to yourself. And if once you build a relationship with a salon, having a conversation with the manager or the owner, because they do care so much about what the customers think. Everything they do is for the customer. It is absolutely not rude to raise your concerns to a nail salon owner or manager, if you do it in a tactful way, of course, right? But the last thing they want to do is to lose your business. And so they want to better understand what is the norm nowadays that customers are expecting and moving with industry trends. And if it's now moving towards industry trends to be more conscientious about the personal care products we use and what we're putting on our body and what we're applying on our skin, they're going to take that feedback seriously, or else you're going to go to the salon down the block that has a better ventilation system, that has cleanlier practices, and that is more conscientious about their product selection.